Hey guys, Dr. J with Elevation Spine, here with Hannah. Hannah's had a shoulder injury in the past, and we were just talking about shoulder mobility. So I wanted to show you guys a test that some of our patients might be familiar with. It's called a wall angel. It's a great way to not only assess shoulder mobility, but how strong the lower traps are in terms of guiding that scapular rhythm that we look for when you're reaching overhead. So the way that you can test yourself with this at home is Hannah's gonna stand next to the wall. Your feet don't have to be touching. They can come out just a little bit. But Hannah's gonna make sure that her sacrum, basically the bottom of the low back, is against the wall. Her rib cage is against the wall. And she's gonna put her hands up into kind of a W position. And she's gonna wanna make sure that the elbows are touching as best they can, and then the wrists. And what you'll notice is as you start to reach overhead, it's really tough to maintain that position. You'll feel a lot of like almost burn in the mid back, right? Now what I want you to do is make sure that your head's nice and tucked. So you'll see that at points, some of her contact with the walls basically coming off, right? Especially with the wrists. And that's kind of that external rotation range of motion. The reason this is important is you can't swing a dead cat without hitting somebody that's damaged their rotator cuff. Everyone talks about rotator cuff injury, rotator cuff injury. This is a huge player in that. You can go ahead and relax. I know it's not an easy position to hold. This is really a key structure for shoulder health, right? You've got 4 muscles that make up the rotator cuff. We've done a bunch of videos on how to strengthen those, make sure the structural integrity is there, right? Because the shoulder is not a stable joint. It's got a huge amount of motion in it, lots of ranges of motion, and the biggest player in that is that scapular rhythm, right? Your shoulder can't move if the shoulder blade doesn't guide it. So try this on yourself, see if it's loose, see if it's tight. We'll come out with a bunch of videos on stretches and exercises you can do to make sure that you can maintain that ability to do this wall angel. If you can't and it's really bad, bust it up with a lacrosse ball, come see us, we can evaluate it further. If this is a really painful position, you can have things like impingement syndrome or rotator cuff stress tears or a full rupture in some cases. So careful with this one, don't push it too hard, but let us know what you think and we'll see you next time.